Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hello, I'm I'm calling from the UK, and I'm 73 years old. I got my concussion and a whiplash injury about 6 weeks ago, and I've been following the Concussion Fix and sort of getting along okay. However, just over 2 years ago, I was diagnosed with papillary thyroid cancer and had the whole of my thyroid gland removed. And then I had to have radioactive iodine treatment. And that was that. And I carried on. Following year, about 9 months later, I had a recurrence in the thyroid bed. So I had more surgery, more thyroid radioactive treatment. I don't know about in the States, but in the UK, one of the treatments is to overdose you with levothyroxine to stop the cancer. Anyway, I've reduced it down with my doctor, so I'm on only on 75. It's micrograms, isn't it? Not milligrams now. But the problem is, which I didn't realise, of course, is that some of the symptoms are very similar, i.e. the digestive symptoms and the tiredness. So separating what the concussion is doing to me and the levothyroxine is difficult.
Maybe I can make a comment on that. You don't mind, just to kind of, just comment on, just since we started talking about thyroid earlier, how does it interplay with concussion and post-concussion issues? So having thyroid cancer, we've had lots of people that have gone through the program that are on thyroid replacement therapy, and also because they might have had thyroid cancer in the past. When you've had thyroid cancer, again, like you said, it's removed and then there's radioactive ablation and you basically don't have a thyroid to produce thyroid hormone anymore. So it has to be replaced. Now, the good news is that you can replace it and continue to have a very highly functional life and highly functional, a very still adequate levels of thyroid to support your cell metabolism, even though your own thyroid is not producing it. And that's where the thyroid replacement comes in. So levothyroxine, or Synthroid here in North America, is the standard of care. And that's the precursor form of thyroid hormone called T4. The brain interprets the levels of T4 and it produces TSH based on those levels. So if you have adequate levels of T4 because you're medicated, and you've found the right dose to get the TSH into normal range. Now, here's where it starts interfacing with post-concussion issues. Some people, after they have this thyroid replacement, and they feel amazing. They feel good because they had lots of symptoms of underfunctioning thyroid before. And so for those people, it can be a big positive thing. Some people start to have thyroid replacement and realize that they still have some of the symptoms associated with low thyroid function, like fatigue, poor metabolism. You might have things like constipation, changes in your hair. But thyroid does affect lots of different things. But the point that I wanted to make is that it doesn't necessarily have to be this major limiting factor that is going to impair your concussion recovery if you find the right dose of the thyroid replacement. The final thing I'm going to tell you is that there's a combination of lab testing to assess if this is working. There's a combination of symptoms. And so if your symptom, even though your lab testing may be in normal range, if your symptoms are still having effects of low thyroid or what you might interpret as low thyroid symptoms, maybe that's where your endocrinologist will up the dose a little bit or decrease the dose a little bit, depending on the types of symptoms. And then lastly, they may add something called T3 in. So this is called thyroxine, and it is going to be the active thyroid hormone. Now, it is much harder to supplement or medicate with T3 because it has such a short half-life in the body. That's why doctors preferentially use the synthroid levothyroxine as a replacement, because it's much easier to stabilize levels. So the takeaway from this story is that it should not be a limiting factor in your recovery if you found a balance here.
Okay, thank you. I mean, I'm someone who's always researching everything, and I've been into healthy eating. I've had 2 whole food shops for 45 years. And I'm one of these people who Melinda talked about, who, in inverted commas, knows everything. For example, I've trained as a mindfulness teacher. I've done all the courses. The trouble is, I don't always apply it to myself. It's much easier to apply it to everybody else. So I'm going through this whole course with just delight to be able to sit down and listen and to sit on my hands, if you like, and sit on my mind to stop it jumping about, to hear what I need to hear. So I'm really grateful for that. Thank you. One other thing, I've been doing intermittent fasting for, about 10 years, I think. Should I stop? Because I feel, I don't feel great generally. And looking at the foods and the advice that you give about eating, little and often sort of thing. So, I'm open to do whatever. So one of my questions is, should I just stop doing that for a while? And the other thing, I found something so helpful regards the constipation I was getting from the thyroxine, which is to take kefir every morning on an empty stomach, which was milk, whole milk, organic kefir. But I've always had a mucus issue, and I just sense that, the milk is just sort of niggling away at me. So I could take it in forms of water kefir, or maybe use a plant milk. What would be a suggestion?
Yeah, so I mean, you're talking about a couple things here. The intermittent fasting first is an evidence-based way of eating that's going to be restricting your feeding window to a shorter period of time. And the idea is to try to allow the body to get into a fasted state for a longer period of time, not just overnight. And you're going to have some metabolic benefits. Now, we've talked about this at length during the course because some people, in fact, I would say it is fairly common for people that are recovering from PCS to be more sensitive to blood sugar fluctuations that can occur if you miss a meal or fast longer. And so if you have tried intermittent fasting and you've really given it a good go and you don't feel good while you're doing it, then you may have some of the other what we might call dysautonomic or hypoglycemic, which means blood sugar imbalances. And the autonomic nervous system does play a role in this too, because it also is very sensitive to some of these fluctuations. You might be better served by following a very, very anti-inflammatory and high nutrient dense diet, like described in the Concussion Fix program, and just gauging how you're going to feel during that. And that does include avoiding gluten. And this is a good dovetail into your second question, which is about dairy products. It is a really common question, and when we do this re-record coming up in this next year, I'm going to make sure that I'm going to be very clear on this, because the only food that we talk about as being something that you should avoid as part of the Concussion Fix program is gluten and foods that contain gluten. So that's obviously wheat, but it's not restricted only to wheat. Things like spelt, for example, have lower levels of gluten. And that's the only one really that we've found that the evidence is compelling enough to really give it a trial. Everything else is subjective to the person. So if you've have this feeling or just past experience based on what you've eaten and then the reaction you get after, that maybe dairy products or another type of food is causing a negative reaction, an allergic reaction, a gut reaction, an inflammatory reaction. It could be a whole host of different things. It doesn't just have to be gut related. Then maybe you should avoid that food. But that's very personalized. That's not something that we're going to say everybody avoid the top 5 food allergens. That means people would be eating no gluten, no dairy, no eggs, no soy products, no corn, and then there's probably a couple other ones. But everything else, that's too restrictive, and we want to make this program approachable and achievable right away. We don't want to overwhelm people with too many different restrictions. We actually want to add good things in and really eliminate sugars, alcohol, highly processed foods, or what are called ultra-processed foods, and gluten. So hopefully that gives you some context as you're going through the program, where dairy, if you suspect it, avoid it for a month, just like gluten, and then see if you notice if that mucus goes away. If it does, that's a pretty good sign that you're probably sensitive to it in some way and it's causing an adverse reaction, and maybe it could impact your recovery.
Okay, thank you. Got it. And the last thing, really quick. The other day I remembered that when I was 7 years old, which was 6 years ago, in those days when you rode horses, there was no helmets. And I'd never rode a horse. And we went on holiday and I rode a horse. And my horse decided to gallop. And I fell off and got concussion. And I can remember my mother having to wake me up, or she was told to wake me up every hour or something during the night, which I think was an old way of checking that you hadn't died or something had brain injuries. And I just wondered, is there anything about having more than one concussion in your lifetime? How many concussions can you have?
I think what you're trying to say is that if you have a history of concussions, is that somehow predisposing you to having more concussions or to having more symptoms of concussions? The answer, resoundingly, and Dr. Cam would agree with me, he's not here right now, he has answered this question before. The answer is no. So, what we don't fully know is the cumulative effect of multiple concussions over a period of lifetime. It doesn't seem like that impacts the chance of getting another concussion or even getting post-concussion syndrome based on the evidence. However, just based on my clinical experience, I think people that have sustained multiple concussions that they haven't fully resolved, and that's the big thing, is that if you have unresolved symptoms, or maybe you're back to 80% and you're like, okay, it's good enough, but I still have a lot of neck pain and I still get dizzy when I get on boats or when I drive. Well, that's not fully resolved. And so if you sustain another concussion, that I think has an additive effect, and that is more in the realm of post-concussion or persistent concussion symptoms that haven't been fully resolved. But just because you got a concussion horse riding 40 years ago doesn't mean that you're now predisposed to dementia or more concussions now if that has resolved.
Okay, thank you very much for taking my question. Thank you.
You're welcome. Good questions. Thank you for asking.
That was that piece I was thinking of as well, Dr. Paul, is, Dr. Cam's constantly kind of driving that home, that idea of like the cumulative effect. If you haven't recovered between concussions, that's something to look out for, not if you've had a concussion at other times in your life and recovered. So I'm glad you mentioned that.
100%. Yes, I agree.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.